here in Ontario. And this budget does nothing at all to fix that. We can make the investments that matter the most to people. And I'm here to say that that's what the focus of the Ontario NDP will be. If we're able to form government, which I can tell folks, that's where we're headed. And Ontarians have a really important decision to make. There's no doubt, but I want to assure folks that if we come together on June 2nd, we can do what all Ontarians really want, which is fix our healthcare system and make sure that the things that matter most to people are being addressed by their government. So that's what we're here to talk about today. And I'm really proud to be here in Scarborough with such great candidates and want to take any questions that folks might have.
So we'll move to questions on Zoom straight away. Please go ahead, Jody.
Good morning. Your first question is from Colin DeMello, CTV News. Colin, please go ahead.
Hey, Colin.
Hey, good morning, Ms. Horwath. I wanted to kind of have a bit of a big picture view here of what the NDP needs to do in order to kind of secure that election victory on June 2nd. So do you envision kind of moving your party a little bit more to the center to try to capture some of those liberal and maybe even some disenfranchised conservative voters in order to kind of build that coalition for a win in June?
Thanks for the question, Colin. What we are going to do is spend the next 35 days, talking to Ontarians about what matters most to them and letting them know that they can have a government that fixes the things that the Conservatives and Liberals have had a hand in breaking. We all know that the Ford government made things worse for folks. I mean, things are harder than they were 4 years ago for everyday families. Everything's going up in terms of costs and expenses, but the thing that's not going up is people's paychecks. So people are struggling. But at the same time, Stephen Del Duca and Kathleen Wynne left us with a hospital system that where there were people waiting in hallways for care. Hallway medicine is the legacy of Kathleen Wynne and the Liberals. Of course, when Doug Ford came in, the first thing he started to do when he got into office was cut in our healthcare system, cut in our long-term care system. I think COVID showed us very clearly what the Liberals left us in terms of long-term care as well. People want to know that the things that matter most are being addressed by their government. That's the conversation we're having with Ontarians. And I can tell you that folks agree. They agree that we need to fix those things and we need to take some costs off of their backs. So that's why we're talking about pharmacare. Nobody should have to wonder if they can afford to fill their prescriptions. That shouldn't be happening in Ontario. People shouldn't be going to emergency wards because they can't afford the root canal that they should have gotten and has now turned into an abscess that's causing them other health problems. They should be able to take their kids to get fillings at the dentist, but they can't because they can't afford it. So dental care is also going to be something that's going to help people financially. So we can fix the systems that are broken, at the same time help people afford a life here in Ontario, which is getting harder and harder for people to do.
Okay, thank you. I just wanted to ask about something the Ontario Liberals are promising. So they're promising a 1% surtax on companies that earn more than $1 billion a year and a 2% income tax hike on people who earn more than $500,000 a year. And I know you have mentioned in the past that you are looking at additional tax measures for those companies, for people who earn a lot, for people who you say don't pay their fair share. Is that something that aligns with what the NDP might be thinking about, a 1% surtax on companies that earn more than $1 billion and 2% income tax hike on $500,000, or would you go further than that?
Well, in fact, we got the fiscal position of the government yesterday, of the fiscal position of our province actually yesterday with the government's tabling of their budget. So we're going to be working up all of those numbers and we'll have some final numbers in the next little while for all of you. But let's not forget the other half of what the announcement was from Stephen Del Duca. It was basically trying to fix something that they broke in the first place. I mean, they're the ones that put the HST on on prepared foods under $4 or over $4 rather. So everything over $4 that's prepared foods, we've been paying HST on. That was a Liberal decision that at the time we didn't support. Now he's trying to fix that by saying, well, we're going to take the HST off prepared foods under $20 now. We can't trust the Liberals to do the right thing in the first place, and we've seen them hurt families over their 15 years in office. You know, it was really disappointing for people that the Liberals left us with the legacy that I just talked about in healthcare, but they also sold off Hydro One. That's the legacy of the Liberals. They brought us the gas plant scandal. I think people pretty well understand that this time is a chance to actually support a party and have a government that fixes what matters most to you instead of making gimmicky announcements.
Your next question comes from Randy Rath from CHCH. Randy, please go ahead.
Morning, Randy.
Hi, Andrea. Good to talk to you. I'm wondering about a situation in Hamilton, up on the mountain, I believe, where a private residence has been flying a Confederate flag. The mayor really wants the thing removed. We have been, the police have been hard pressed to give us any answers. They essentially haven't. What do you think should happen in this circumstance?
I'm really disappointed, Randy, that flag is flying. Certainly, people have the right to their opinions, but the Confederate flag really does bring concerns around racism. I think it really is hurtful and painful to Black people in our community, particularly, and it's extremely disappointing that that's happening. I wish that we didn't have to have those kinds of symbols of hate, showing up in our communities. And certainly one of the things that we want to do, should we get the chance, is actually start fighting hate. Fighting anti-Black racism, fighting Islamophobia, fighting against anti-Semitism and transphobia and homophobia and sexism. Let's face it, we're all people, and we all belong here in Ontario and in Hamilton and in our communities, and we need to support each other, not tear each other down.
Should it be illegal to simply fly one of those things?
Well, again, I think what we want to do is provide Ontario with mechanisms to fight against that kind of hate. That's why we forced the Liberal government. We pushed them with community to establish the Anti-Racism Directorate, which of course Doug Ford has cut off at the knees, basically almost completely defunding that organization. We're going to put that back in place, as well as other pieces of legislation through the Our London Family Act, which will help us have more tools to fight against organized hate and to protect people from some of the more horrifying instances that we've seen where people are actually being physically accosted, where people are being killed, where people are being attacked, particularly in their places of worship, but also just right out on the street, like we saw the tragedy that happened in London, that the racist Islamophobic terrorist attack that happened in London a couple summers ago. That's just not something that we can abide in our province.
And with no more questions on the line, I'll turn it over to you, Andrea.
Thanks very much. I want to just once again remind people that we cannot afford more of Doug Ford's cuts. So $2.7 billion in cuts means fewer nurses, fewer PSWs, 29,000 fewer nurses, 70,000 fewer PSWs at a time when we need to be not only recruiting and retaining and returning people that Doug Ford has already pushed out of healthcare because of his low wage policy, Bill 124. But we have to shore up our seniors care system as well and make sure people have the things that they need, the kinds of services and programs that support their families and make life better for all Ontarians. Thanks, everybody.